I am a cancer specialist, and if you ask me which cancer I dread most, then the answer will most probably be cancer of gallbladder. Most of the patients of cancer of gallbladder come to the doctor when the disease has progressed beyond the stage of cure. In this situation, survival of more than 6 months is not very common. So today we shall discuss why this cancer is so dangerous and why it is diagnosed that late and what can be done to avoid getting caught by this dangerous disease. Gallbladder cancer is one disease that is not discussed much among public and among doctors also. The reason is its relative rarity in Western world. Still, it is a huge problem for our country, especially in the national capital region. Let us first understand what is a gallbladder. Gallbladder is a pear-shaped organ that stores concentrated bile, and this organ lies just below the liver. This bile is released into the small intestine when the person takes fatty food. The next question is that when should we think of possibility of cancer of gallbladder? The symptoms of cancer of gallbladder overlap with other relatively harmless conditions. And this is one big reason that even doctors are not able to suspect the disease in early stages. The symptoms of cancer gallbladder can be a simple pain in upper part of the abdomen, or it can be in the form of jaundice. Sometimes it comes in the form of a palpable lump in the upper abdomen. And as we see, jaundice and upper abdominal pain are very common illnesses that people keep on getting. So nobody thinks that it can be because of extensive cancer of gallbladder. Early stage gallbladder cancer most of the time is an incidental discovery. It is discovered when abdominal ultrasound or CT scan is done for some other pathology. Many a times a small focus of cancer is discovered in a gallbladder that was removed for some stone disease or some other problem. So it is pertinent to request the doctors practicing in the community to have a low threshold for getting an ultrasound done, which is cheap, which is simple, and is widely available. Everybody will be interested in knowing that who all can get gallbladder cancer. Then the answer is that anybody can get it. But still, the risk factor that is associated maximally with cancer of gallbladder is presence of gallbladder stones. If we see the whole world, then a very small percentage of those people having gallbladder stones actually develop gallbladder cancer. But in our country, especially in the northern part of the country, the figures are very high. So this low percentage of gallbladder stone turning into gallbladder cancer can be a dangerous assumption in northern part of our country, that is India. In North India, especially around Delhi, gallbladder stone disease is very common. No wonder that gallbladder cancer also is very common in this area. The large size stones, particularly single stone, they have relatively higher risk of leading to gallbladder cancer than small multiple stones, but it should be understood that no condition is exempt. Any type of stone can cause the gallbladder cancer if remain there for a long time. There are small tissue projections in gallbladder lumen which are called polyps. If polyp is present in gallbladder, then this also increases the risk of subsequent development of carcinoma of gallbladder. So we need to get alerted if gallstones are present in a person who is living in high prevalence region. Once the imaging studies suggest that there is a possibility of cancer in gallbladder, then the next step is to ascertain if it can be surgically treated. Remember, removing only the gallbladder affected with cancer is not going to get rid of this disease. It needs a much bigger surgery which is called radical cholecystectomy. Radical cholecystectomy is of course a big operation, but it is rewarding. I have a good number of my own patients who are all right years after this surgery. So if surgery is advised, please don't get scared of it. Remember, in cancer of gallbladder, if your doctor says no to radical surgery, then it is a bad news. If someone's gallbladder has been removed for stone disease and it shows presence of cancer of gallbladder, then the person should be evaluated for possibility of further radical surgery as early as possible. Remember, CT scan and PET scan normal after removal of gallbladder do not indicate that the person does not require further treatment. They actually indicate that the person is suitable for radical surgery. Many a times, many precious lives are lost because the family or sometimes the non-specialist doctors, they believe that why get operated if the scan is normal. So please do not fall into rumors. Trust what your specialist says. If someone is suitable candidate for surgery, then some blood tests for tumor markers are done. Contrast CT scan or MRCP study might be asked for in addition to PET CT scan. Even during surgery, the surgeon might prefer to put a laparoscope first to see if there are small nodules that have been missed by the imaging studies and that indicate dissemination of disease. Once surgery has been done, then you will be offered chemotherapy according to the stage and state of the disease. If the disease has spread beyond gallbladder, in that condition surgery does not help. Chemotherapy is valid option in that situation. It is given in the form of injections with or without tablets. The person needs to be fit to receive chemotherapy because chemotherapy, as we all know, is a relatively toxic treatment. Many a times when the patient is unsuitable for chemotherapy because of health reasons or because of financial reasons or whatever the reason, maybe many times there are personal preferences of the family, they refuse chemotherapy. In that condition, the treatment is given only according to the problems, according to the symptoms. So it is in the form of stenting for jaundice, painkiller for pain, antiemetics for vomiting, and so on and so forth. Stent is generally placed through endoscope through your mouth. In tough situations, however, a drain of bile might be placed through the skin. Many a times it is possible to put a stent through this channel and remove this bag which is lying outside your body. The doctor will discuss with you the possibilities and the options of metal stent and plastic stent depending on your suitability and finances. Your doctor might ask you to get some special tests done on the biopsy. These tests help in deciding the targeted therapy. They identify targets that can be targeted by the specialized drugs, but we should not expect miracles from targeted therapy. This treatment also is given to improve quality of life in terminal stages of cancer, and it cannot cure an extensive cancer of gallbladder. Whenever we discuss any cancer, the most common question is if we can save ourselves from it, if we can avoid getting affected with it. Then for gallbladder, I will say the most common association of gallbladder cancer is seen with gallbladder stones. Large single stone is particularly dangerous, though any type of stones increase the risk. Tissue projections into the gallbladder called polypi, they also increase the risk of gallbladder cancers. While it might be relatively safe to leave alone a stone affected gallbladder in areas where the prevalence is low, but the same might be very dangerous in endemic areas. Gallbladder surgeries these days are very safe, they are relatively cost effective and are available in smaller towns also. It will definitely lead to some avoidable surgeries, but at the same time it will also save a lot of precious lives that might have been affected by cancer of gallbladder later on. So if living in areas where the gallbladder cancer is relatively common, it is safer to get a stone affected gallbladder removed. Many patients have misconceptions about chemotherapy and the families leave the patients to die a slow and painful death because of hearsay about their side effects. I will reiterate here what I explained in my video on treatment options, that any treatment, whether chemotherapy or anything else, is offered only when the benefits outweigh the side effects. It is not uncommon for families to realize this later and request chemotherapy later on. At that time, the disease has advanced and the patient has become weaker. So the chemotherapy doesn't give many benefits at that time. It is too late. So please do not fall for rumors. Take treatment as advised by your specialist. Treatment of cancer gallbladder may also depend on the age and the general health of the patient. The symptomatic treatment depends also on whether there are symptoms or not. Once the patient has completed curative treatment of cancer of gallbladder, like any other malignancy, they need to come for regular follow-up checkups to ensure that they are safe. Please do not show carelessness in this one aspect. Sometimes the disease comes back even after apparently curative treatment. It happens because of inherent aggressive nature of the disease. Generally, treatment of relapsed disease is done with chemotherapy. And as we all can understand, any disease that has come back in spite of best treatment will not give you very good results. So the recommendations can be summarized that the person who is having gallbladder stone disease in areas where the cancer of gallbladder is common should get the gallbladder removed. Like any other cancer, early diagnosis and adequate treatment is important for cancer of gallbladder also. With all this, I wish all cancer patients a speedy recovery and everybody a good health. Thank you.